Hello, my name is Rachel Bodie Lepelholtz, and I am a family nurse practitioner student at Franklin University. I will be completing a presentation on Acne Vulgaris. What is Acne Vulgaris, commonly called acne? Well, acne is an inflammatory disorder of the sebaceous gland and the hair follicles, together called the pilosebaceous unit. A pilosebaceous unit are primarily found on the face, back, upper arms, and chest of an individual. So who can get acne? Well, acne can actually occur at any age. Pediatric acne is categorized by the patient's age and maturity status. Neonatal acne, which is not truly true acne, occurs from birth to 6 weeks. This condition is relatively self-limiting. Infantile acne occurs from 6 weeks to 1 year and again is really self-limiting. Mid-childhood acne is relatively uncommon and it occurs from age 1 year to 7 years. If you see acne in mid-childhood, look for an underlying condition that's causing it. Pre-adolescent acne, age 7 to 12, or reach of menarche for girls is very common as all the androgen changes are happening. And then adolescent acne is extremely common. This is that stage where everybody's going through the change. Typically, acne presents at age 8 to 12. It does have its highest incidences among people aged 12 to 25 years old and peaks relatively around the 15 to 18-year-old age. However, nearly 20% of adults can have acne. Most acne occurs in females, but when males have it, it is often more severe. So how does acne form? There's actually 4 factors that create the phenomenon of acne. Increase in sebum production, which is usually androgen influenced, like in puberty, then creates a keratin and sebum plug that plugs the hair follicles and will lead to a hyperkeratosis, which is this comb dome formation we will talk about soon. Bacteria then proliferates in the sebaceous follicle and stimulates the release of an inflammatory cytokine. This inflammatory cytokine will create that red, irritated appearance of acne. What are some of the risk factors for the development of acne? Well, hormone changes is by far the biggest risk factor. During puberty and during pregnancy, your hormones fluctuate, and that can create changes creating acne. Medications such as corticosteroids, testosterone, and lithium can also cause acne. Your diet, carb-rich foods will actually increase acne. Low glycemic index foods have been shown to improve acne by reducing the sebaceous gland activity and the growth that's associated with increased insulin levels. Stress. Although stress does not cause acne, if you already have it, stress will make acne worse. Age. Anyone can get acne, but it's most common in teens during these hormonal change times. Family history. Genetics plays a role in acne as well. Children with parents or siblings who have acne are more likely to develop the condition themselves. Oily substances, cosmetics, oily lotions, creams, when they come in contact with your skin, can help or lead to the development of acne. Friction or pressure. Helmets, hats, telephones, collars, masks, any constant irritant to your face can help create or enable that inflammation that can lead to the sebaceous follicles becoming irritated, blocked, and create acne. Let's talk a little bit about the acne lesions. Comedones are primary lesions of acne. They are caused by a defect in the shedding of the skin at the opening of the pilosebaceous follicle. They shed epithelial cells, then become sticky, and they form a plug that blocks that follicular opening. It can take up to 2 months for a comedone to form. Comedones are non-inflammatory and are often referred to as open or closed. We may know them as blackheads and whiteheads. Other acne lesions consist of papules or pustules. They're the excess oil, bacteria, and dead skin within the pilosebaceous follicle. P. acnes is a common skin flora, but produces an inflammatory response when it's irritated in the sebaceous follicle. Papules are comedones that become inflamed, small red or pink bumps, and they may be sensitive to the touch. Pustules, however, resemble closed comedones that become inflamed and are often filled with white or yellow pus. Nodules or cysts are other actinic lesions. Nodules are large inflamed bumps. They usually feel firm to the touch and often develop deeper in the skin and can be painful. Nodules frequently cause scarring. Cysts are large pus-filled lesions that are painful and also cause significant scarring. Let's walk through a common clinical presentation of an individual with acne. Typically, patients is an adolescent male or female who has tried several over-the-counter treatments for months without any success. They're likely to suffer from dry and irritated skin due to the use of the topical anti-acne drugs. Males often present with more severe cases than females, but females may have a significant emotional distress response related to their appearance associated with their acne. Mild acne were the comedones with few inflammatory lesions. These lesions are mostly mixed comedones with some papules. They occur mostly on the face, but can occur on the chest, back, and arms. Occasionally, the comedones can be irritated from scratching and become inflamed. Light pressure applied to an open comedone can release this plug. Moderate acne. This is when the comedones have marked inflammatory lesions, also called inflammatory acne. This involves many papules appearing in color from pink to red in the light-skinned patient, caused by an infection of the comedones, the P. acnes. Many pustules may be present as well, with yellow to green tops that surround by inflammation and redness. These pustules may rupture, and scarring can be likely, especially when the pustules are large and deep. Severe acne. Extensive inflammatory lesions with diffuse scarring. Nodulocystic inflammatory acne. This acne usually always results in scarring. Nodules are the inflammatory lesions that appear bright red to dark brown and are deeper in the skin. These are very difficult to treat. The most severe form of acne is called acne conglobulata. This involves nodules, cysts, and abscesses that connect with fistulas under the skin. This often occurs on the face, arms, trunk, and back simultaneously. When seeing this in clinical practice in a female, think about evaluating that patient for other signs and symptoms of PCOS. Diagnostics are usually not indicated when diagnosing acne. It is made by the classic location and characteristics of these lesions, as well as incorporating the patient's age. A complete health history is critical to the proper diagnosis, as diagnostic tests may be indicated if there is an underlying predisposing condition that may be the cause of the acne. If acne fulminanis is suspected, a CBC, chem panel, urinalysis, and ESR are very helpful. If PCOS is suspected, a complete history and physical exam with labs including a serum and free testosterone as well as a pelvic ultrasound should be obtained. The initial treatment for mild acne is a topical retinoid such as adapalene or benzoyl peroxide. Adapalene is a great choice because you are less sun sensitive. Benzoyl peroxide, 2.5%, is just as effective as 10% and is less irritating to the skin. Be sure to look for water-based versus alcohol-based benzoyl peroxides to prevent overdrying of your skin. Alternative treatment. Moderate acne. The initial treatment for moderate acne is a combination topical retinoid and benzoyl peroxide therapy with a topical antibiotic. Again, this is your clindamycin and benzoyl peroxide or adapalene and benzoyl peroxide. Inadequate response to this therapy will call for oral antibiotics, a dermatology referral, or possible hormone therapy for the females. Oral antibiotics. Severe acne is very difficult to treat. Initial therapy is the combination of oral antibiotics, topical retinoids, benzoyl peroxide, and topical antibiotics. If inadequate response to this therapy, a referral to dermatology should be made for aggressive treatment with isoteratoin. It's a vitamin A derivative that has shown to be effective when response to conventional therapy is not working. Tetratianone and isotetranianone are often confused by patients as the same medication. However, tetratianone is an active ingredient and is a topical medication. Isotetratianone is an oral medication, and it is used to treat all types of acne. 2 negative pregnancy tests must be obtained within 1 week before starting this isoteratone, and 2 reliable forms of contraception must be used while on the medication. Monthly pregnancy tests may be required by the dermatologist or practitioner while on this medication due to its effects on a developing fetus. Category X pregnancy category. The patient must have maintained effective contraception for at least 1 month before, during the entire course of treatment, and 1 month after therapy. Topical retinoids normalize the desquamification of follicular epithelial to prevent the formation of comedones. The side effects of topical retinoids include skin dryness, itching, erythema, and photosensitivity. Examples of some topical retinoids are listed there. Precautions include using sunscreen. Do not apply topical retinoids at the same time as benzoyl peroxide. This medication is not recommended for the use in women who are at risk of being pregnant or are breastfeeding. It is important to use an effective form of birth control while using a topical retinoid due to the effects the retinoid could have on a developing fetus. Benzoyl peroxide has antibacterial and comedolytic properties. Generations of free radicals that oxidize the protein in the cell wall. There are many forms of benzoyl peroxide. They come in over-the-counter or prescription forms in gels, washes, lotions, and foams. They can also be found in combination agents with antibiotics. Side effects of topical benzoyl peroxide include the bleaching of the hair, skin irritation, dryness, and sun sensitivity. Note: 2.5% benzoyl peroxide works just as well as 10%, and it is less harsh on the skin. Make sure you look for the water-based versus the alcohol-based benzoyl peroxide to help decrease your risk of skin drying. Topical antibiotics reduce the number of bacteria on the skin, as well as reduce the inflammation in the inflammatory acne. Examples include erythromycin, clindamycin, or Flagyl, often used in combination form. Side effects of topical antibiotics include skin dryness. Clindamycin is definitely not used alone due to its antibiotic resistance, and it may cause diarrhea. Apply moisturizer daily to reduce irritation. And remember, this is often used in combination with benzoyl peroxide to prevent the development of antibiotic-resistant organisms. Oral antibiotics reduce the colonization of the skin and the hair follicles and are used in the treatment of moderate to severe inflammatory acne. The first-line treatment is your tetracyclines, doxycyclines, and minocyclines. Second-line treatment is macrolides. This is often combined with benzoyl peroxide to prevent antibiotic resistance. Side effects of oral antibiotics include GI upset and photosensitivity. Minocycline can cause vertigo, dizziness, and hyperpigmentation. However, GI upset and photosensitivity are less common with minocycline. The cyclines are contraindicated in pregnancy and children younger than the age of 8. If there is no response in 3 months to the therapy, consider increasing the dose or changing the treatment, or referral to derm at that time. Tetracyclines can be taken with food to prevent GI upset. They do not interfere with birth control, and it may take 2 to 3 months before improvement occurs. Make sure you do not lie down after taking a tetracycline to prevent against esophageal erosion. Minocycline can also have pigmentation appearing in small amounts of patients. These skin deposits can be from a brown to a blue-gray in color and may not fade after treatment is discontinued. Hormonal acne is kind of a different offset in its own. So hormonal acne can be treated in females. Spirolactone can be used. It's a mechanism of action. It's an androgen receptor blocker. Some of the side effects include the diuresis effect, hyperkalemia, and some irregular menstrual periods. Another medication used for hormonal acne is the oral contraceptives. They suppress the luteinizing hormone production and they block the androgen receptors. So the orthotricycline, Yaz, Estracep, those are FDA approved for the treatment of acne. Side effects of the oral contraceptives include nausea, vomiting, abnormal menses, weight gain, and an increased risk for PE and DVTs. So next we have oral isotretinoin. This is a retinoid divertative, and it will target all 4 factors of acne. It's used in the severe nodular cystic acne and then when all other therapies have failed. This is a medication that is important to take with meals, and it's important for the clinician to monitor lipids, glucose, CBC, and liver enzymes. Some of the side effects you can see are listed below. Elevated liver enzymes, elevated blood sugars, high triglycerides, and this is category X for pregnancy. So it is absolutely critical that a patient does not become pregnant while they're taking this medication. It is also indicated that the FDA has a mandate that any patient on this medication will sign up for the iPledge program. It is on 2 forms of reliable birth control during the treatment. The likelihood a patient is to have good results correlates very much with their adherence to the treatment regimen. So developing a regimen with a high likelihood of adherence will help get those results. And it's important to let your patient know that treatment will be targeting new lesions and not the present ones. Lack of adherence is the most common cause of acne failure. Topical agents will take 2 to 3 months before clinical effects are seen. So overall, therapy should be trialed for at least 8 weeks before a regimen is even altered. Many patients are non-adherent due to the side effects of acne treatment, which would include the dry skin, the redness, the burning, the stinging. Acne treatments are deficient in cremides, which they allow the skin to retain their moisture. So it's really important to educate your patients on the application of a moisturizer daily to improve the dryness and irritation, this low oil moisturizer. And that will lead overall to better adherence because of less side effects. If you're using prescription medications, avoid over-the-counter products that are not part of this treatment program. This will help prevent the overall over-drying of skin. It's also really important to prevent overwashing or the facial scrub, so any of the excessive abrasion to the face that could cause increased irritation. That will cause, in the long run, side effects that will lead to non-adherence. So there are many non-pharmacological or alternative therapies that can be used in conjunction with or alone from the standardized treatments that we talked about. The surgical comedones extraction is often used with topical retinoids. The beta-hydroxy acid peels or the chemical peels, those are used to reduce acne scarring, so that would be used in conjunction with, say, the severe acne algorithm. Fractional laser resurfacing, this is using a subcuticular cutting or a fibrous scar tissue with a hypodermic needle to kind of break up some of those deep scars to lessen those. Microdermabrasion, this is used in conjunction with the other therapies just to get a nice clean level of skin and kind of get all the dead skin away from the surface. Augmentation, which is a soft tissue filler. This will help fill in scars that have developed over time from moderate to severe acne. There are different photodynamic therapies, pulse light therapies, blue light therapies, red light therapies. Those have been shown to have some benefit in conjunction with other treatment regimens to decrease the severity of acne. Tea tree oil is one of the essential oils that has an antimicrobial and an anti-inflammatory effect to it. This oil has to be diluted with a carrier oil, so when you're thinking about it, you want to avoid putting oils on your face, but the tea tree oil and this carrier oil need to be diluted before they can be put on your face. So these can be very sensitive, so spot test before you actually go and place a bunch of tea tree oil in your face, because contact dermatitis, dryness, irritation may develop with the use of a tea tree oil. Diet is really important. It's been shown, like we talked about before, the glycemic index, what kind of foods you eat, have a overall relational factor to how severe your acne is. So the foods that are really high in sugar and carbs, those seem to cause a little more acne than the low glycemic foods. And then overall, just having acne education. So when you're teaching your patients, you want to tell them to use a soft facial antibacterial soap, very mild, like a Dove or a Dial, and do that twice a day. Wait at least 30 minutes after you wash and cleanse your face before you put on any of the topical acne medications. That will lessen the skin irritation from going from the rubbing motion of the washing to the application of the medications. It's really important to drill into your patients' heads that topical acne medications should not be used on open skin, cuts, abrasions, sunburns. If any of these conditions develop or are developing while you're using the product, consult your doctor. Avoid contacts with your eyes, lips, nose, mucous membranes. That goes for all of the acne medications. It's really important to use sunscreen when you're using any of these acne treatment medications, avoiding the oily makeups and scalp products. And then if you can avoid touching things to your face, so cradling the phone in the nape of your neck, along your cheekbone, that's where we see a lot of acne because of that, that contact irritation from holding the phone there. And then avoiding the excessive scrubbing on your face. So you don't need to be doing scrubs to your face every day. That will just add to the irritation that could worsen the acne over time. Like I talked about in previous slides, acne does have an effect on a patient's quality of life. More often than not, it's going to affect females a little harder than it will males, but then overall the males have the more severe cases. So patients with moderate to severe acne experience greater psychosocial and emotional stressors and impairments than their peers who do not have acne. Symptoms and treatments of acne care and the factors will really influence their quality of life. So how much you're willing to help them and how much effort you're putting into helping them and creating a treatment regimen will definitely reflect on their quality of life. There is a acne disability index tool. It's the Cardiff Acne Disability Index. This can help the practitioner address how acne is affecting a patient in relation to the quality of life. And I do have that index here on the next slide. So these are some of the questions listed on the Cardiff Acne Disability Index. As a So follow up on a patient with acne treatment, mild, moderate, severe. It's really going to be patient specific based on their needs, their underlying causes, their psychosocial development associated with their acne. There might be some depression that's really, drawing out a lot more issues, but the acne is the primary cause of this depression and anxiety. But in general, a patient should be evaluated 4 to 6 weeks. This would monitor their response to the therapy. Though so far, look at any potential side effects. This is also a time to address non-compliance issues. It may be that the regimen chosen is too strict, and something needs to be altered in order for the patient to be successful in relieving some of their acne. It's also an important time to address birth control options, birth control plans. You might have started a patient on one of the medications that a pregnant or breastfeeding woman cannot have, and now she's decided, I think I want to have a baby. This is the time to go through and talk about that and how that's going to change your treatment regimen. And then it's really important to relay at this 4 to 6 week visit that these clinical improvements may not occur for 2 to 3 months. So we're only at maybe the halfway point. We need to give it some more time to really be effective, and so that they may reap the full benefits of the clinical results of this reduced acne. So in the world of acne diagnosis and treatment, it's first important to recognize the severity of the acne. Is it mild, moderate, and severe? Then you can go to the algorithm, which is available on the up-to-date resource, and follow the moderate acne algorithm, and it will take you step by step through the presence of pustules, papules, nodules, and you can see what is first, second, third line treatment and conjunctive therapies that you can educate your patients on when it comes to acne management. It's also really important to remember how acne is affecting their lives and how they see themselves and how they interact with others. So always taking into consideration, I'm not just treating the acne, I'm treating the psychosocial and emotional aspects that acne has over this person as well. I hope you found this presentation to be really enlightening. I know I learned a lot, and I look forward to learning more from all of your videos this week as we complete our dermatology assessments and discussions. Thank you and have a great day.